Good morning, you guys. I'm back here with our favorite person, Dr. Willey. It's been a while, I feel since we've been doing it.
Busy summer, chasing kids.
School's about to start. Life is crazy. So anyways, we decided we are going to talk about perimenopausal and menopausal weight gain today. It's a question I get in my inbox all the time. It's something I struggle with, and I know a lot of you do as well. So hopefully you can hear me. Give me a thumbs up if you can hear me. I just want to make sure that
I can hear you.
I'm glad you can hear me. That would be a problem.
Yeah, that could be a problem.
But let us know. Okay. Hi, they're saying hi. Okay, great topic. Okay, they can hear us. All right, so we're going to just kind of start. I think we should start with the basics of kind of what I'm hearing, what you hear in clinic, and then how people can kind of see some results, how they can feel a little bit better.
Sure.
Because I think one of the biggest things in perimenopause, and we've talked about this a lot, is that we just feel horrible, right? Like all of a sudden we just don't feel like ourselves, and it's really, really frustrating. And one of the biggest complaints is weight gain. And I know for me, we'll talk about me. We'll start with me. Okay, so I'm pretty active. I've always been active. I was a college tennis player. I've always been in the gym. You did bodybuilding with my husband. I've kind of like, I don't know, I tried some of the stuff you guys were doing and was not successful by any means, but I feel like I'm a very active person. So at 43 years old, when all of this started happening, I was still doing my gym stuff, still working out all the time. Then I started paying attention to people on social media, right? And there are these buff ladies, you guys know what I'm talking about. They look amazing, I wanna be like them. I'm doing all the things, I'm spending hours in the gym, I'm lifting super heavy weights, I'm eating all this protein, and last week I come into you, and I'm in tears almost because nothing is changing for me. In fact, I'm gaining weight. So let's start with that. Tell us a little bit, let's just start with why do we gain weight, especially in the midsection, as we hit perimenopause?
Great questions, and this is a big topic, nothing personal.
Hold on just a minute. It's saying blank screen. Hold on. Sorry, 1 second. They say you can hear me. I don't know why, Joanne, you can't hear us, but I think everybody else can. Okay, keep going. We'll see. Give us a thumbs up if you can hear us. Just one more time. I don't want you to go into this whole thing and then they can't hear us. Okay, I can hear you. Okay, all right, you're good.
Awesome.
What was my question?
Okay, yes, I remember your question. So, as you asked, let's go back a little and talk about weight gain, weight loss. Let's talk about the fact that everyone's a fitness expert because they have a six-pack. Where that correlates with your brains. We've always called people meatheads, but no, I'm a meathead. It's okay. But let's go into why that's a problem. First of all, when we've mentioned this before, menopause has been dictated by a clinical event called no periods for 12 months.
Right.
Average age is 51. But we all know the hormones change 15 plus years prior. Mm-hmm. And that's when women start gaining weight. Mm-hmm. We joke in my office, you go to college, you get the freshman 15. You start menopause, you get the menopausal 40.
Yes, it's true.
And even if you don't gain weight, to your point about where it is, your body changes. Yeah. The shape changes.
100%.
That's hormones.
And that's when people start noticing, I think, the most, right?
Yep.
Yeah.
Yep. And that's a hormone thing. Because honestly, ladies out there, after the age of 40, you cannot undereat your fat and you cannot overexercise your fat. It's impossible. Mm-hmm. It's just, unless you're starving yourself, you're on Ozempic or Wegovy, you're not eating, you're exercising way too much, then you don't have a butt because you lose too much muscle.
Yeah, we talked about that.
You just cannot eat less and exercise more and change your body type. It's a hormone thing. Okay. And by the way, drugs like Wegovy and Ozempic and Mounjaro are hormonal-based drugs.
Yeah.
So what happens is as you start to lose estrogen, even if it's not obvious on a lab, and that's another big area that these wonderful people have a problem with is my labs were normal. Every doctor said my labs are normal. It's like, well, wait a minute, you're telling me it's not normal, and you just told me your waist went from a 26 to a 29, but your scale didn't change. Well, that's hormones. Yeah. That's estrogen in particular. Yeah. And that's, if you replace hormones early, you never go through that. Your body shape doesn't change like that because the problem is a hormonal issue.
Okay, so I'm going to just stop you here. So if you're on HRT though, hormone replacement therapy, for those of you that don't know, why can you still gain weight on that? Like, why are you still gaining weight if you're replacing hormones?
So there's other hormones.
Okay.
So yeah, that's
hormones.
Exactly. That's one thing we always try to differentiate. When we say in my profession hormones, the thought is thyroid or sex hormones.
Okay.
But there's about 65 others.
That's crazy.
Yeah, and they all play a role. Your neurotransmitters in your head, your stress hormones, huge. Yeah. And the stress hormones are survival hormones. Cortisol shouldn't be called cortisol, it should be called survivitol. Yeah. Because it's a survival hormone. And if cortisol is high because of high stress, high sympathetic tone, our kids going back to school, the world's whatever it's doing, that's going to override, it's going to shut down the sex hormones. Even if you're on them, it changes them, it changes the way your body responds to them because you're in survival mode.
So you're just storing all the fat. You're
storing, right? You think about it. 1,000 years ago, before we had all this technology and all this stuff, there's two reasons you had high cortisol. One, the fear of getting eaten by something.
Right.
Or the fear of not eating. And so what happens when you don't eat enough? Cortisol goes up. Everything you do eat is stored and saved. Thyroid hormones stop functioning to keep you slower, keep you down, so you don't burn off your calories and die. It's a survival instinct that we're dealing with now, but we have plenty of food. So food's not the issue. Food now is the problem because you're in the survival hormone mode and you're still eating.
Okay.
And so that's why if you're on HRT or still have normal sex hormones, but are stressed, your body's going to change.
Yeah. That makes sense. Someone just asked a question about, she said she went on high estrogen birth control. I know a lot of people do this and then gain weight. Can your HRT also be causing you to gain weight? I know birth control is a form of it, right?
It is not a hormone replacement. It's an artificial hormone.
Okay.
So it can have all sorts of different consequences. Most people are fine with it, but a lot of women I deal with are not. And remember, it's not just a hormone, it's hormonal balance.
Okay.
You can't just give someone one hormone and think that it's going to solve everything.
Okay.
Great for birth control, but what else is it doing? And what are the other hormones doing in response to it? Remember, it's all on a system. It's all on a grid. From your brain all the way down. It's all talking. They're interacting. They're part of it. Oh, this is low. Let's me increase over here. So yes, sometimes high dose any hormone can be mischievous in your body. Okay. Especially if there's not balance.
So you're saying with hormone replacement or just anything that a doctor or an OB is giving someone, it needs to be a balance versus like, here's a birth control pill, this is going to solve everything.
Right. Birth control pill will solve birth.
Okay.
It may change dysmenorrhea or terribly hard and bad periods. But there's other ways to do that too. And without knowing it, you may be causing issues for later.
Okay. I know a lot of people are talking about birth control. We will get to what you're going to be able to do about your weight control. We're getting there. We just want to kind of give you the kind of background a little bit. Talk to us really quick about visceral fat, because that's another thing that we hear a lot about.
So visceral fat's your bad fat. That's a fat between the organs. The beer belly on the guys, that's visceral fat. Visceral fat is also called toxic fat because it releases something called toxic cytokines that cause inflammation, cause heart disease, precursors to cancer. Visceral fat's a bad fat.
Okay.
It causes the bloating, the large bellies and stuff. Treating visceral fat, there's a number of ways to do it, but there's actually an FDA way, approved way, and that's by increasing your growth hormone. Very important hormone in your body. Higher growth hormone levels burn visceral fat.
Okay.
So that's one option there. But visceral fat also, if you see visceral fat, you probably have what we call non-alcoholic fatty liver disease, unless you're an alcoholic. Then you have alcoholic fatty liver disease. But if you're a non-alcoholic fatty liver disease, you have to fix that. And that's part of the visceral fat issue, because when the liver starts getting fat and starts working improperly, then you get dysmetabolic syndrome, insulin resistance, diabetes, hyperlipidemia, arthritis, all this stuff. So treating the liver is a great way to start if you do have a belly. And that's a very simple solution. It's called phosphatidylcholine, which is a fatty acid. Any health food store has it, 1 gram a day, which it looks like a big horse pill. And it's a pill, not a suppository. And it'll treat your liver. And then a lower carb diet helps, and a lower calorie diet helps treat your liver. That's where we would start, answering a question earlier.
Yeah.
Where do you start with this stuff? If you're having struggles with weight, treat your liver.
Treat your liver.
Treat your liver.
Okay.
avoid liver toxic stuff like Tylenol, alcohol, Tylenol, and then avoid Tylenol.
Okay.
And then obviously processed foods. And you guys know it. I mean, it's not rocket science.
Yeah.
It's not easy.
It's
but it's not rocket
easy.
science.
I think in our world right now, like the fast pace of everything, even the processed food's really hard, right? Even if you're trying to make wise choices, it's really, really hard. Okay, so start with your liver. What percentage of women in perimenopause or menopause have fatty liver disease?
Well,
Roughly.
statistically, 85% of Americans have it.
That's crazy. So starting with your liver.
It's a problem.
Yeah, that's really interesting. I know I actually had it when I came into you.
Yeah, you did.
And I didn't even know what it was. And I thought, what am I doing so wrong to have it? But when you gave me those stats, I was like, okay, most of us have it and we don't even know it. So that's something we're still treating, right, with me, kind of. So, okay, so let's go back to where we were in the very beginning, which was what can we do about it? So a lot of us are watching social media. A lot of us are listening to trainers or people that are saying, like, lift really heavy, eat all this protein. I was eating 120 grams of protein. I weigh about 120. And I was trying to get that 1 gram per body weight, which is what I hear on social media. And give me a thumbs up if you hear that, because that's the people I'm following and I think they look amazing. But when I came into you, I was like, literally, I have been in the gym for 2 hours a day. I'm doing all of the things that I'm supposed to be doing. Tell them how you what you like diet-wise, things like that, what maybe I should be changing. And so maybe they could be changing that too.
Sure. Well, first of all, everyone's an expert. And unfortunately, if you just look like an expert, doesn't mean you're an expert.
Right.
A lot of this fitness-based science is very appropriate for fitness-based people, bodybuilders, fitness stars, stuff like that. But for the rest of the world, it's way too much training. And remember, from here up, exercise is good. From here down, it's a stress. Mm-hmm. So if you're in the gym 2 hours a day, you're stressing the hell out of your body, and you're not going to lose weight that way. You're back to that survival mode because you're not recovering. The amount of protein you need and stuff, there's been great studies. There was a great study done in boxers, and boxers are extremely athletic people.
Yeah.
They had them on 40 grams of protein a day, and none of them lost muscle mass.
That's
I think
crazy.
the amount of protein that's suggested out there, and I am guilty of this. I will throw my hands up and tell you, I've written books on this, on how much protein you needed. But as I get older, I'm not older, I'm wiser.
That's right, 100%.
Wiser, thank you. As I get wiser, I realize I'm different. I can't do the 250 grams of protein a day. I maybe do 50 to 60 a day now, Lauren.
Yeah.
I don't do that much.
Just crazy.
I like being lean. I'm about 5% body fat. I like being leaner, feel better, but you don't need that much because remember, there's still calories in there too.
Right. That's the one thing too, right? Like I think I was getting a
you're
lot more calories.
If you're getting 600 calories in just your protein.
Yeah.
That's too much. You don't need that much. You're a small woman.
Yeah.
So I think that's a problem there. And then with the exercise stuff, heavy is what's preached out there. Well, one, we see a lot of injuries with that. So that's a doctor talking there. Mm-hmm. But really, that again, back to it's a stress.
It's a stress.
I think we have to realize, and there's some great studies on this, that blood flow is the key. And the best way to get blood flow to a muscle that you want to change shape to is higher reps, lower weight.
Which is so opposite of everything I've been like reading or watching from fitness experts, which I think they're great. I'm not.
Oh yeah.
I'm not
and
saying
you know
we're.
what? If it works for them,
that's
awesome.
Yeah, and they look amazing. But here's the deal. You actually switched to me just recently, like the last week and a half, and I'm telling you right now, I'm in and out of the gym. I am more tired than when I was in there for 2 hours lifting really heavy. And
just afterwards, though, not all day.
Yeah. Yes, it's like a quick, but then I feel better. Like I have more energy. Yeah. So I kind of at first was like, wait, you want me to do that? Because that's opposite of everything, right? But yeah, and the other thing I'm hearing is no more cardio after the age of 40. Like stop doing cardio. So I was like, I stopped doing cardio.
This is a muscle.
I don't.
You need to work it too.
You gotta work everything, right?
Yes.
Like I think that's the one thing. It's like an all or nothing thing is what I'm hearing, and women are just kind of jumping on that, and then we're not seeing the results, and then we get more frustrated, and it's like this downward spiral, right?
Yeah.
So, okay, someone says I will post the name of the supplement. I promise. After this, I will actually have like a little call to action, and you can comment a word. I will think of it, and I will write down all of this.
Do you know how to spell it?
I hope so. I hope so. Do you have an IG? Yeah, you do. But are you going to be using your Instagram very much?
I have one. I don't know how to turn it.
Yeah. But there's better ways to find him.
Actually, I am. We're just opening a new clinic. This is where we are right here in my new clinic, and you have new website, all the social media stuff. My kids have been telling me for years, I got to get out of the dark ages, so
yes.
I'm doing it.
So next one we do, we will have a lot more information. He has a podcast and things like that, so we're going to get you all that information. But after this live, when I do post it, I will put some notes down, and you can comment a word, and we'll send it to you. Okay, what else can we be doing for weight gain?
So if I may, I want to do a couple more little tidbits on
Please.
Exercise. So if you think in the terms of blood flow, getting in and out of the gym quickly keeps cortisol, the stress hormone, down, and you recover quicker. And really that's, if you really want to get optimal weight as you're in your perimenopausal years, you have to think recovery. And not think exercise, not think diet, but recovery. And that's where you do lower calorie eating, that you do quicker in and out of the gym, get blood flow. I mean, get in there and bust your honey, do 25 reps, 3 sets of maybe 3 or 4 body parts, 2 or 3 exercises, and leave. That will do so much for you on so many different levels, for recovery, for weight loss, for muscle building, all that stuff. Just being in the gym for 2 hours, because this is what I see. I see these people in the gym, they lift weights, they do 5 reps, super heavy, and then they're on their phone for 10 minutes. And then they get home and stressed because they need to make dinner or they need to do this, and now they're stressed because they sat around. Well, that's not doing anything. Get in and out.
Yeah.
Do it. Yeah. And remember, I'm not a fitness. I'm not one of those men and women out there that look so good like that. But I'm just telling you, from a practical, real life standpoint, recovery is the key, and you just have a hard time recovering when you're in the gym for 2 hours.
Yeah. No, it is true. So if someone doesn't exercise, let's say they're not used to being at the gym, they're not used to doing cardio, they're not used to lifting weights. What are some simple steps that they could start doing to improve and feel better with the weight gain?
Did you catch that? That was a joke. Simple steps. Exactly. Go for a walk. That's it. And I'm telling you, I think we did this a couple weeks ago. A 30 to 40 minute walk after your last meal of the day is probably the most metabolically active thing you can do. It's so good for you. And it's, take your loved ones with you. Take your pet. If you have a cat, good luck. But a dog is great. Take them out and walk for 30 to 40 minutes after the last meal every day. You don't have to be a bodybuilder. You don't have to be a gym rat to get the physique you want. It's, of course, if you want that physique, yes, it changes it. If you're a power lifter and you want to lift more weights, yes, you got to lift heavier. But if you just want to feel good, look good, and be able to function every day, it's a lot easier than you think.
Yeah, I mean, that's really a simple thing that anyone can do. Because I know in my DMs, a lot of people are like, well, I don't lift, I don't do all the gym things, like what can I do? I'm gaining weight. And I think that's just a really simple thing. So 30 to 40 minutes after your last meal, go on a walk. And spending time with your loved ones, right? Get off the phone, get off the TV, all of those things that we do that does raise our cortisol levels. And go just take that moment. I know for me, when I just go on a walk, everything just is like, you know? So, okay, I love that. All right, do you have any other, actually I have one, let's see. Lower reps is opposite to what I've heard. I thought the premise behind heavy lifting was to help mitigate osteoporosis. Oh, that's a good question.
Oh, that's an excellent question. Any resistance against your bones is going to help mitigate osteoporosis. I could go on a whole different tangent on osteoporosis, so I won't do that. But lifting weights of any way, shape, or form is going to help it. If nutrition's proper and the hormones are where they should be, you're not going to get osteoporosis.
Okay, which is another reason to work with a functional medical doctor, right?
Right.
Okay, if, let's say that you're 120 pounds, I'm there too, how much protein should we consume?
I'd say 40 to 50 grams a day. And there's different variables that I don't know about this person. Disease states, kidney function, autoimmune in particular, we do some changes and stuff, but is a general overall blanketing number, 40 to 60 grams.
And what's your favorite type of protein?
I like plant-based protein the best. I really do. I eat lamb and I eat fish. I had a hamburger the other day because it was my son's birthday. That's what he wanted.
But you didn't feel good, you said.
I usually don't eat too much red meat. And again, very different from what I used to be, but I'm different. As we grow older, we get different.
Yeah.
And so I'm probably preaching more to that crowd now than the bodybuilding crowd anymore, which is fine.
Yeah.
It's that's my favorite type of protein.
How do you feel about like getting your protein with protein powder or protein bars?
Never, ever, ever drink your protein.
That is so opposite of you from years ago.
It is, yeah.
I'm just laughing because I know I've known him forever, and he was a bodybuilder, all these things. So I'm like, wait, what?
Oh yeah, we did gallons of whey protein every day. I mean, I'm old enough that I grew up in Colorado, and we would get whey directly from the dairy farmers.
Oh my gosh, that's funny.
Because it wasn't popular protein back then. Egg protein was all you had, and if you drink egg protein, you have no friends because you fart all the time. But so we would get this actual whey from these dairy farmers.
That is crazy.
But if you drink your calories, you change your hormones. Insulin goes up. Insulin starts a cascade of events that makes you gain weight and stuff. It's better to chew your calories, especially as you get older and into the perimenopausal years, because now we have to deal with the hormones. And insulin's one of those hormones we deal with.
I'm kind of shocked by this. Oh, not only because I know you, but because I'm like, oh, I don't have time to get protein down. I'm just going to do a protein shake. I'm so guilty of that. But chewing your food, that makes sense with what you're saying. So
and that's not a blanket statement. I have a protein drink in my bag. If I get too busy with patients and I need some nutrients, I will drink it. But it shouldn't be a staple.
Okay.
It should be if I need it.
How do you feel about 10,000 steps per day?
Oh, it's awesome. The more movement you can do, the better. I mean, honestly, the secret to longevity in life is lower calories and movement. I mean, if we really summed up the blue zones, if you're not familiar with the blue zones around the country, they're areas where people live into their hundreds, very, very active. And the two main commonalities is they always move and they eat low calories across the board. And it's different cultures. I mean, in Spain, in Italy, in actually San Francisco, there's a big Seventh-day Adventist group out there. Japan, these blue zones are very different culturally, but that's the commonality.
And it's interesting in other countries. I mean, just touching on that, you go to like Italy and they're eating a lot of pasta and they're very lean. Mm-hmm. It's everything opposite of what America says to do. Mm-hmm.
That's why.
But they walk everywhere. I mean, if you think about that, they're walking and they're moving like you're saying. So. Yeah, it's interesting.
And the cultural thing goes back to gut health. I mean, a lot of them probably were on antibiotics the whole time they grew up because their ear hurt.
Yeah.
I mean, there's so many variables there.
Yeah.
And that's why we like to preach. There's no such thing as a bad food. There's just bad diets.
Right.
And the diet is determined by your culture, by your activity levels, by your hormones, by your activity. All these things play in if you really, and that's where back to finding a functional medicine person that can really help you put that together for you is the secret to success, because everyone's different. Yeah. I like to tell people we're all under this umbrella of human physiology that makes us the same, and then we're all different. Everything's
really are.
Different. Yeah.
Well, and I feel it's like, I always say it's like we're all puzzles, right? But we're all trying to find the different pieces that fit for us, because what might work for me isn't going to work for somebody else, based on how their health is and things like that. So I think it's hard. That's why it is really good. Okay, let's do a couple more. Someone says they're walking 3 miles a day. They need to do something for their arms and legs. She's 70. What could she do? What's something really simple they could do?
Grab 2 soup cans on your walk and
That's what
do
Nick's
curls,
grandma
do presses.
Used to do. Yes, with the
soup cans. And if you can buy little hand weights, 2, 3, 4. I mean, every pound you can think of. They have little handles on them. There's gloves that fit on that have weights you stick in the front and back like heaters. Walk with them and just move your arms, do them above your head.
Add it into your walking.
Add it into your walking. Yeah, that's a wonderful question because people don't realize how simple that is, and that is enough resistance to help build and protect the wrist, because we worry about the wrists and osteoporosis.
Mm-hmm. What about weighted vests? What do you think about that? I know that's a big trend right now.
Oh, weighted vest? Mm-hmm. As long as you can recover from it, it's not killing you. Yeah, I think it's a great idea.
Okay. All right, let's see if there's any other questions. Is anemia part of perimenopause? Can that
anemia?
Be yeah, can that be anything?
If they have heavy menstrual bleeding with anemia, so they're dysmenorrheic, or in other words, their cycles are super heavy, yeah, you can get anemic.
Okay.
You lose enough blood where you can become anemic.
Okay. I've never heard that. Okay. Krista, if you're looking for a functional medical doctor in your area, if you go to my website, I have Dr. Willey's information there and links, so I can also put that information when I post this. If you are estrogen dominant, do you still need estrogen as part of your HRT plan?
Oh, that's a great question.
Is that good? I don't know what that means.
It must be someone not from the States, because they said estrogen, which is what they do in Europe. So,
okay.
Yes, it depends on where the estrogen is coming from. Estrogen dominant people or women are usually heavy from here to here. So big breasts, have belly, skinnier behind, skinnier legs. They have heavy periods, painful breasts when they have periods. That's more of the estrogen dominant appearance. Well, remember, part of that estrogen production is coming from the fat right here. It's not just the ovarian fat. And we have a lot of women in our practice who are in their mid-50s, heavier, that don't need estrogen replacement yet, because they're still making a lot of estrogen right here until we lose weight, and now we need to add it in.
Interesting.
So yes, you do still need estrogen. And there's been a debate, I was just reading this the other day, about does the estrogen produced by fat with aromatase activity, is that equivalent to estrogen produced by the ovaries? That's a debate. I can't answer that because I don't know, but empirically speaking, just have done this so long, I would say it is different enough that measuring a total estrogen is not a good way to go in those people, but treating symptoms is.
Okay.
And balance. Balance it with progesterone, testosterone, DHEA, pregnenolone. I mean, the list of the hormones need to be balanced.
Okay. I'm just going to randomly ask you these, if that's okay.
Sure.
Do you recommend hormone replacement during perimenopause? I know your answer, but let's just go over it again. She says, my labs always come back normal. I feel crazy. This is like everyone. I feel horrible when I hear these messages.
Yeah, so that's a big issue with perimenopause. Your hormone levels, from your pituitary hormone, we check LH and FSH, to your ovarian hormones, to your adrenal hormones, the androgens, etc. Really during that perimenopausal transition, which, as we talked about earlier, can be years, do not always show up on the labs. I mean, I've done this before with patients where we had a lab draw, it showed one thing, and we literally did the lab draw the next day because something was missed, and they repeated the whole thing, and they were completely different.
That is crazy.
Perimenopausal area labs are everywhere, so you really can't trust them. You really got to go. You have to trust the person you're talking to.
Yeah.
I do as a physician. I would say, okay, you wouldn't be here if you didn't have your symptoms. And I'm not going to rely, and I said this last time, and I think it's so vital, I don't use labs to make a diagnosis. I use labs to confirm what I'm thinking. You're going to tell me the diagnosis.
Yeah. And I think that's what a lot of, like we've said in a lot of these lives, women just are not being heard. Or they're going to maybe a general practitioner that maybe doesn't have this right training, things like that. We've also talked about that.
And their hearts are where they should be. I'm sure they would do anything
100%,
to help people.
Yeah.
It just, Prozac is not a hormone retreatment. So if that sweet lady said she was going crazy, don't take Prozac.
Yeah, don't do it. Well, the depression medicines, and I mean, we could go into all of that, right?
Oh,
that
gosh,
they're
yeah.
being given. Okay, let's see. How do you feel about bioidentical HRT and menopause, risk versus benefit? I know we've talked about this. Can you do it like a real quick?
Sure. Oh, yeah. BRT is the way to go. Bioidentical hormone replacement just means that the hormone chemical structure looks exactly like what you made at one time, versus something artificial like Premen, which comes from a pregnant mare. So it's actually 60% equine estrogen versus human estrogen. So bioidentical hormones, absolute must. There are FDA-approved, insurance-covered bioidentical hormones, just so you know, a little FYI, because people think, oh, if bioidentical, I have to have it made, which means money out of pocket, and that's not easy for some people. So there are FDA-approved ones that are very beneficial. They work great. They're bioidentical, but I think it's of incredible importance through the perimenopausal stages, because you're preventing so much in the future, for one, and you're have a better quality of life right now too. I just think the benefits so far outweigh the risk. Yeah. It's an individual treatment, and that's why it's important to sit down with someone that knows risks and benefits, can look at your history, look at your family history, look at what other meds you're on, other concerns you have, be it insulin resistance, diabetes, osteoporosis, whatever, and help you find the right solution. But again, as a general response to that, yes, women should be on hormones earlier than we're putting them on.
Okay.
And remember, the studies that have shown problems, like the Women's Health Initiative, all those women were over 60. The average age was 63.
Yeah.
In other words, they missed 20 plus years of prevention.
That's crazy.
And that put them at a higher risk for hormones therapy at that age. So why not start back here? Now you can see they're starting to start back here and go all the way through.
Right. That's so interesting. I always find the research and how old the people are and the different variables so interesting, because I think we attach to the bad stuff, but we don't really like know what the research is actually showing.
Right.
You know, you just hear
And
what
why?
the news say. Exactly.
Why is it showing that?
We've talked about combating abdominal visceral fat. Someone just asked the same question, so go ahead, Julie. Make sure you watch the video again. Let's see. I don't know if I want to go into that one. Let's see. Thank you for being compassionate. It's really hard when you feel crazy and know something is wrong and they just give you antidepressants.
Oh, you're not crazy, girl.
No, you're not.
Nope, you're human.
Yes, I will be sharing this. IUD or HRT?
Oh, IUDs are good birth control. I'm not a big fan of the progestin-laden ones like Mirena, because in my experience, again, this is empirical, it's great birth control. But progestin is an upper hormone in the cascade, and I've had the experience, a number of women, where that artificial progestin caused problems downstream because they weren't making progesterone anymore.
Interesting.
They're on progestin. And so, and
Which is different.
Which is different, yeah.
Okay.
That now progesterone's bioidentical. Progestin is artificial.
Oh. Okay.
And Mirenas have artificial progesterone. Wonderful birth control, don't get me wrong, but in some women it causes some issues.
Okay.
Copper IUDs I like, but in some women it causes some issues. There are questions we ask to help us determine which one might be better. But overall, as a birth control, IUDs are wonderful.
Okay.
And there's nothing wrong, girls, you're all going to appreciate this. Your husband can get a vasectomy. I was
like, where are you going?
I'm going to get
What are you
punched in
about
the
to
nose
say?
for that one.
I know. I'm like, there's
we're
someone.
doing a podcast.
Yeah, there's someone at the door behind us. We're like, oh,
Hold on one second.
hold on, you guys. I'm gonna get to a couple more.
We're doing a podcast.
Oh my gosh!
Hi, Warren's wife is here. Come on in, Dart.
Hi!
She's trying to open the door behind
That's
you.
why you're
Come
not
in.
answering your phone.
Yes, that's so funny.
Sorry, I'm interrupting.
We're glad you're
This is
here.
my lovely wife.
I have
This
questions
beautiful
for you.
wife.
I need the gas card.
Oh,
She needs a gas card.
I have gas. No.
Hi, Lauren.
How are you?
I'm so good.
Hold on, you guys.
Sorry, I'm
She
interrupted.
needs her gas card. That's a big deal.
I'm out of here.
See
Come
you.
on.
Good to see you. Okay. Let's just do a couple more because we've been on for a while. Do you can having your uterus removed mess with your hormones?
Oh, absolutely. If anatomically, if you think about it and look at even like a chart like from Netter, Netter's a famous medical and anatomical artist. Almost in most women, up to 50% of blood supply to the ovaries comes up through the uterine artery. Try cutting off blood to your hand and tell me what happens. So yes,
I mean,
it can cause a problem in some. And that's not well recognized, but I can tell you, after seeing it for this long, it is a thing.
Wow.
As a matter of fact, I would even say in some women, ablations start problems.
Really?
Oh yeah, and I
That's
can't. There's
interesting.
not really any studies on that. Our wonderful OB-GYN friends will probably say no, that's nothing to do with it. But why do I see it so much?
You're seeing
I'm because I'm not a surgeon, so
Yeah.
I won't see. I mean, surgeons do their surgery and go on, but I'm seeing these wonderful
The
people
after
all the time.
effects. That's
so
interesting.
it is interesting, and obviously that doesn't affect everyone, but it's something that someone like me or another doctor would. It's in the back of our head.
Yeah. Interesting. Okay. All right. I think. Anything else you want to add to this?
No, I think we threw a ton at him.
I think we did too. Okay, I will do my best because normally you're amazing. Sarah is here to write notes, but I'm gonna do my best to like write down as much as I can to kind of summarize everything and get you the information you need. So give me some time. I am gonna post this. I'm gonna give you a word that you can comment. If you don't get the notes right away, it's because I have to go home and I have to write them all down before I give them to you. So as long as you have the word, let's just say notes, we'll just go it that way. When you comment notes when I post this, I will get all this information to you. Just give me a little time because I've got 2 sick kids at home and I got to drive home. So it'll be a minute.
And she got caught behind a train coming here.
I know. It's just kind of been a morning.
I heard the panic in her text.
I did. The high cortisol levels. That's what I run on, high cortisol. Okay, you guys are awesome. If you have questions, please, when I post this, you can put it in the comment section. He's a text away, so I do text him and I do ask him those questions. So just so you know, if there's something he can answer, I will make sure and get back to you with that too. But thank you for your time. You're always the best.
Oh, it's so much fun.
They all love you. I love you, and you're the best. So we'll be doing another one next month.
Yeah, and we're going to talk about gut health.
Gut health, you guys.
Gut health and how it relates to perimenopause. They are so related. Oh my
I'm
goodness.
really excited about this one because I am really interested in this, and I know you guys are too. So, all right, thank you.
Cool, thank you.
Bye, guys.